Now, unfortunately, the data on what affected burnout at that time wasn't too good. So a lot of the early wellness efforts by the healthcare systems were put into things like mindfulness or yoga or, office parties or things like that, birthday celebrations, things that we know now do not affect burnout one bit. It's, like I said, it's mostly an environmental issue. It's the things that prevent you from doing your job. So vascular surgeons don't get burned out from doing vascular surgery. They get burned out from doing all the things that are unrelated to vascular surgery. The second trial looks at wellness in vascular surgery, mostly integrated residents. And what we found was that the levels of burnout were about 40%, or very similar to what we were seeing in attendings. And again, it makes sense because they're working in the same environment. We found some things that were very unfortunate. It seems to disproportionately affect women in vascular surgery, and that's one of our first findings. Another important thing, again, it all ties back to this being an environmental health risk. And so the level in vascular surgery programs was not stable. Some programs have a lot of burnout, some programs had less burnout. And that's good. That means it's modifiable. That means there are best practices that you can achieve to have lower burnout.